Vesico-vaginal fistula, or VVF, is an abnormal communication between the bladder and the vagina, which is caused as a result of a prolonged and obstructed labour. In itself, that's normally due to a lack of access to obstetric care during delivery. There are two ways that we can treat fistula. One is with a surgical intervention, and the other is by providing a psychosocial support to the patient after the operation has taken place to ensure their reintegration into their community.
WAHA International is an international organization for women and children, and we are working especially in Kenya regarding fistula issues. And as you know, fistula is the problem of remote area of women living, poor women living in remote areas who don't have access to health care when it's time of delivery, so they deliver at home.
The problem with VVF is not many women like talking about it, so you really have to probe the community for them to come out, and they also fear the cost, although we have told them that it is free. So we expected at least to get about 10 from our area to come to this place. And we are also thinking we want to form support groups for them after the operations, such that we can use them as advocates to spread the message to the other, especially those who will be treated.
We usually use the radio. We use the vernacular radio system in the country. We also have radios within the hospitals which are connected to AMREF. We also use the health facilities, the dispensaries, health centers, and the community meetings to announce about the services. And usually, if it is well done, women are ready and they are always willing to come.
So we are here for this week, and we hope we can help as many women as possible. It is our belief that all the women that are in Makueni can come and get this service, which is supported by WAHA International.
I'm here today to provide the fistula repair services to the women in this area, and also acquire more skills in fistula work.
Jabiliture kendaga, fantamasi kendaga.
We can help is obviously number one, training the local physicians and surgeons. But what they will need obviously are funding for equipment, for basic equipment and supplies. And the good thing is much of the equipment is very basic. You know, it is not a surgery where you require very fancy instrumentation or fancy testing. It is very, very doable for a small amount of money. But I think you can do so much good if we can all band together and really target this problem. You know, not just fixing the complication, but as WAHA International, one of the goals is to prevent it in terms of education, in terms of prenatal care and education for the mothers, and typically the young mothers, so that this is not a problem. So you want to target this twofold. We will fix the problem when it occurs, but the best would be we would like to prevent the problem, so that you have less and less of the fistulas to fix.
We are restoring their dignity. They are very happy because once they didn't know there is something treatable. And again, the access of man, as you can see, those who have fistulas, those mothers, they are poor to start with. They are young girls who are school going, and if you conceive, it's very hard to now communicate you are pregnant and you want to be taken to the clinic. So they intend to keep quiet until the day now they start labor. By the time they reach the hospital, they had already obstructed labor. So the results, there is a stillborn, the baby is not alive, and then they develop this because 3/4 of the patients with the fistulas have got obstructed labor.
Bayimaro kendaga dabibala kendaga dabiture kendaga.
She's Elizabeth Muizi, 49-year-old lady. She's a lady who's been having leakage for around 20 years that developed after her third delivery. She was actually done a cesarean operation, but subsequently after the operation she started leaking urine for 20 years. She actually went, there was some bit of intervention at the hospital, but apparently didn't succeed the operation. So she's been quite a depressing experience for the last 20 years, having leakage of urine. Yeah.
This is a terrible quality of life problem. And in some ways, I tell my patients that I take care of, and I see a great many of these in the United States, in our area, that it is almost like social cancer. But it is even more terrible. But when you have this problem, you are shunned and you're an outcast. A woman we fixed yesterday, 20 years she suffered. 20 years this has happened. Nobody wants you, your friends, your family. So this is something that goes to the core of the community, okay? Because this can be your mother, your sister, you know, your daughter. And this is something I think it behooves all of us, not the local community, the national and the international community, to really band together.
Miwawa yekide seilam bimi seilam yo